a requirement for all areas to have a health and wellbeing strategy. The strategy has identified priorities for reducing health inequalities and improving health and wellbeing for our local population. I'm very pleased to introduce and recommend to Council this evening Thurrock's Health and Wellbeing Strategy for 2016 to 2021. The strategy is an easy to read and understand document focusing on prevention and early intervention, adding years to life and, more importantly, Madam Mayor, life to years. This strategy is the result of detailed needs analysis and engagement of both providers and users. Indeed, I'd like to say thank you very much to Health Watch and indeed our own Kerry Armstrong, who have done a really fantastic job on the consultation. This is not a document, Madam Mayor, to sit on a shelf. It's a working document that is measured through an outcomes framework. Council are aware of the reduction in our budgets whilst our demand continues to grow. Most of our health budget is focused on ill health, that's hospital care. This feels like the tail wagging the dog, Madam Mayor. Therefore, our strategy focuses on prevention and early intervention, getting the most for our Thurrock pound. I would like, first of all, Madam Mayor, if you'll indulge me, to look back on how successful our very first health and wellbeing strategy has been. Okay, first of all, we've got a fully developed LAC service with evaluation reports showing the value of this service and indeed achieving highly commended accolade last week. Development of a housing scheme specifically designed to keep people well, Derry Avenue, opening of our 4 GP hubs, Basildon Hospital now out of special measures, Madam Mayor, development of Thurrock's first Better Care Fund, further development of asset-based community development and delivery of Elizabeth Gardens, our extra care housing facility. Our children and young people have been really, really impressive, Madam Mayor. Thurrock's been performing above the national comparator average for children with good level development. The number of pupils achieving grades A to C GCSE has improved greatly. There is an improved rate of young people achieving at least a level 3 qualification by the age of 19. Thurrock has launched the multi-agency safeguarding hub, otherwise known as MASH, and there has been strong performance on young people not in employment, education or training, our needs. The number of looked after children, Madam Mayor, living in suitable accommodation has improved, and the new strategy will build on these successes. It's been developed with full involvement of local population and guided by that information from our population, and I'd like to thank all of our partners for developing this piece of work. Just a little bit more, Madam Mayor. Through our detailed analysis of evidence and public engagement and consultation, Thurrock's strategy is focused on our 5 goals: opportunity for all, healthier environments, better emotional health and well-being, quality care centred around the person, and healthier for longer. On page 35 you can see the outcome-focused objectives supporting these goals. The principle of this strategy are, Madam Mayor, to reduce inequality in health and well-being. We want things to get better for everyone, but we're also committed to ensuring that our poorest communities enjoy the same level of opportunity, health and well-being as the most affluent in our communities. Prevention is better than cure. Rather than waiting for people to need help, we want Thurrock to be a place where people stay well for as long as possible. Empowering people and communities, we don't just want to do things to people, but to give people the opportunity to find their own solutions and make healthy choices. And connected services, good health and care services should be organised around the needs of people, not around the needs of the organisation.
Can you sum up?
I can. This strategy, Madam Mayor, is extremely well thought out in the most effective way to achieve better outcomes for Thurrock's residents. I'm asking that Council endorse this draft strategy and outcomes framework and recommend its approval tonight.
Improve the health and well-being of our residents. We always lead the way on this, and long may it continue to be the case. Perhaps we need to start selling ourselves to people like Highways England to show that actually when you do listen to people, when you ask the right questions, when you think about the problem and you formulate an answer, you can come up with a document that actually ticks all the boxes and makes sure that we are fit for the future. So again, congratulations, Councillor Weiss, on this, and I'm obviously agreeing to it. Thank you.